Carrie is a 45-year-old female who was referred to our office by her family physician for depression, loneliness, lack of appetite, and being lethargic. She has 3 daughters, and she's a widower. Her husband died 10 years ago. Uh, Carrie reported that since her husband died, she has been the sole provider for her 3 daughters, and her life basically revolved around them. She didn't take care of herself. She was worried about being both mother and father to her children, and the one social life that she used to have is no longer. And now that her youngest daughter has left for college, she feels lost and alone and doesn't know what to do. So we're going to help Carrie reconstruct a new life. Hi Carrie, how are you today?
I'm okay. How
Good.
are you?
I'm good, thank you for asking. So Carrie, this is our second session, and you were just going to recap on our first discussion to make sure we're both on the same page. Um, you were referred to us for outpatient services due to the fact that you are feeling alone, lost, and a little bit depressed.
Right.
Is that correct? Okay, and you started feeling this way here a couple of weeks ago when your youngest daughter went off to college. Is that correct?
Right.
Okay. And you've been the sole provider and supporter for your 3 daughters since your husband died 10 years ago?
Right.
Okay. So, Carrie, tell me how your week has been going so far.
It's been okay. Nothing really uneventful has happened. I go to work and I talk to a few of my coworkers and am friends with them at work, and they talk about their families. A lot of them still have kids that live at home, and so that kind of gets me sad because I think about my girls. And then after work, they have their spouses and children to go home to, and when I go home from work, it's just me there, and I pretty much just watch the same shows that are recorded or watch the news, or a lot of times I don't bother cooking anything for dinner because it's just me, so it's kind of pointless to cook for one person. So sometimes I just eat a frozen dinner, and if my girls call me, if one of them calls, I'll talk to them, but if not, then I usually just go to bed around 7:30 because there's nothing else for me to do.
Okay. So, you were saying, is this something that you do every day? Just kind of go to work, come home, eat a solitary dinner, watch TV, and go to bed by 7? Is this an every night?
Pretty much, yeah, since my youngest left the home, yeah.
Okay, okay. So, since your husband died, how have you been taking care of yourself? Um, Either socially or personally since your husband died? What have you done to take care of yourself?
Um, well, socially, I don't really have a social life because I was so used to, well, when my husband was alive, we were very social people. But then after he passed away, my time was all spent taking care of my girls because they were still pretty young. And so I always, had the house to clean up after, or laundry to do, or activities with them, with school, or just fun activities. And I would only visit with friends, like, I don't know, maybe once every 4 months, if that, because they were home by themselves. And since my youngest daughter moved out, I just feel like I don't really have much of a social life because people at work have their own families to take care of.
Okay, so you don't really have a social life. Your life is just basically revolved around your children, correct?
Right.
Okay, okay. Um, what has been working for you to, to help get you out of depression? Have you tried anything? Has anything been working for you to get you out of the situation you're in now?
Well, not really. When my girls call to check in on me, or if I call them, that makes me really happy. But other than that, I haven't really done anything.
Okay. So, what are some things that maybe you can do to get yourself out into society and meeting people and getting a life for yourself that doesn't revolve around your children? What are something you can do?
Um, well, I do have a friend that I work with who is involved with her church, and her church does a lot of social activities, and she's invited me to go with her several times, and they sound like fun activities, but I just haven't gone. I always seem to have some excuse not to go, and it doesn't really make sense to me because it's not like I have fun at home, but I just haven't felt like going. So maybe if I take her up on her offer and go with her, then I'll meet people there. Or I also like to read, so maybe if I could find a book club that, has people with similar interests like me, then maybe that'll help.
Okay. Have you been able to do anything to get yourself out of depression, or have you just kind of just been going on with the same routines? Have you tried anything to change it up? Anything different in your life to help you get past the sadness and the loneliness and the depression? Or is this coming to therapy the first time that you've thought about changing?
Well, I mean, I've thought about changing because I'm definitely not happy with the way things are.
Okay.
But I haven't tried anything on my own, and I didn't really know what to try. So coming here is the first attempt at changing.
Okay. So you're talking about you were sad, lonely, not very happy since your youngest daughter has moved out, correct?
Right.
Okay, so on a scale from 1 to 10, with 1 being really sad and 10 kind of being, happy with the normal life, where would you rate yourself on a 1 to 10 scale with your life at this moment?
I would say I'm probably at about a 4.
About a 4.
Mm-hmm.
So you have come to see me because you want to change the direction your life is going. Your life has been revolved around your children for so long that you've lost who you are. You've lost aspects of your life where you got involved and did things outside of the house. Is that correct?
Right.
So I want you to think about your current situation. You're depressed, you're lonely, you feel like you have no purpose in life. I want you to think about all that. And then think back to a time in your life before your husband died, and tell me what your social life was like then compared to now.
It was great whenever he was alive because he was a very sociable person, and I'm generally a sociable person, and we would go out with other couples, and we would have cookouts and have people come over, and we would go to movies, just the two of us, or with other people. So it was a lot different. I was much more extroverted, and now I'm much more introverted.
Okay. And did you do things outside of your family, outside of your husband or your children? Did you go to movies or friends, just with friends, alone?
Yeah, because whenever he was still alive, I didn't feel guilty leaving the girls, with the babysitter, or having the oldest one watch the other two. So he would watch them, and I would go like on weekend shopping trips every once in a while with a friend, or we would go to movies or go out to dinner. So it was really nice.
Okay. Carrie, I want you to think back to your past, look at your past, and look at your situation now. And I want you to think about what your future is going to be like 6 months from now. If you still had your social life, what would your future be like now?
Um, I think that if I still had the same type of social life that I had when my husband was alive, it would help me a lot. But I don't really know a lot of people outside of work, and the people at work are pretty tied up with their own families. But I'm glad that you asked me what I can do, because I think going to church and being involved
Right.
with those activities and those groups would help me meet people. And then also, like, if I could find a book club, because I really do like to read, so I think those would be really helpful.
Okay. So, the whole purpose of you coming to therapy is to get you out of the depressive mood that you're currently in today. So I want you to think really hard, and I want you to name this period in your life. Give it a name that's unique and expresses how you feel at this moment.
I would have to call this period, since I don't have my husband or my girls at home, emptiness.
Emptiness. And what made you chose the word emptiness?
Just because when my husband was alive, we had each other to depend on, and then even after he passed away, I still had my girls to take care of. So, I mean, I had a purpose, like they needed me, and I was their only parent, so I felt really important. And now that they're grown and independent and they've moved away, I just feel like I don't really have much of a purpose right now.
Okay. And if we were to reframe the life that you're leading now to a more positive future and get you a social life, what are some of the positive experiences in your past life that you can draw on and incorporate into this new life that you want to reconstruct for yourself?
Well, I know that in the past, whenever I was going out to the movies or going shopping or even out to dinner, it made me happier because, I had someone to talk to, I had someone to share interests with, so I wasn't just by myself. So I know that it would make me feel a lot happier if I did have a social life.
Okay. And have you sat down and thought about goals or experiences that you would like to see accomplished in the reconstruction of your new story? Have you really gave it any thought?
Um, no, not really.
Not really.
Mm-mm.
Okay. Um, I want you to think what 6 months from now your life is going to be like when you have a social life. What you're doing, where you're going, and I want you to think about this new life where your kids are not involved. I want this new life be goals in situations that you would like to see happen in your life, not what you want to see in your children's life. What's we want to see what you want in your life. Think back or think forward and tell me what you would like to see 6 months from now.
Well, I have always wanted to travel.
You have?
But that's always been a big dream that I've had. And, me and my husband had always planned that when the girls were grown, then we would just go travel together. But, he passed away, so I don't have him. But since the girls are gone, maybe I could or not gone, but gone from the house, maybe I could meet somebody who also would like to travel, and then we could go together so I wouldn't have to do it by myself.
Okay, that's a pretty good goal. You're thinking about something that you can do for yourself that doesn't revolve around your children. Besides traveling, have you thought of anything else you would like to see happen in your life to get you out in social?
Well, maybe sometime in the future, like not right now, but maybe sometime in the future, I would get the courage to start dating again.
Okay. So why not? So you would like to maybe possibly date in the future.
Right.
Okay. So we're almost out of time for our session. So I have some homework that I'd like for you to do for us for next week when we meet. I want you to think about your past in the experiences that you had with your husband, the times you went out and you had a social life, you had get-togethers, you had picnics, went to the movies, dinners, lunches, weekend getaways. I want you to think about those times, and then I want you to think about how your life is now, and I want you to make goals from your past experiences to where you're at now for your future goals. I want you to sit down and really think about what you would like to see your life to be like in 6 months and how we can accomplish that. And then I want you to start keeping a journal of activities. And let's see what exactly you're doing every night so we can gauge where we can change the directions in your life. And then I want you to see maybe stepping out and going to the movies, what you're comfortable with, calling up a girlfriend. And I want you to start thinking about that future revolving around you and your happiness and not around your children. Does that sound about right to you? About
Yeah, it sounds. I would love that in 6 months from now, if I could have a social life, like even if I was just going with friends once or twice a week, that would help out a lot, so I wouldn't feel so alone.
All right, well, I want you to think about all that and write it down, and we're work on some goals separately. I want you to work on some goals, and then we can work on some goals together. We can think about what you want to see happen and set out a course of treatment to get it going. Does that sound good to you?
Yeah, it sounds good.
All right, well, Miss Carrie, I will see you next week for our next session.
All right, thank you.
Thank you. All right. I use solution focus model and narrative model for Carrie because her life has revolved around her daughters for so long that she kind of lost herself. She didn't have an identity anymore. So we wanted to, with solution focus, which is future oriented, client driven, we wanted her to focus on the solutions, not on the problems that or what causes the problems. We wanted her to fix the solutions, to find solutions to the problem right now and for the future. And for narrative kind of helps Carrie reconstruct a new story for herself. So her old story revolved around her children. Her new story is going to revolve around herself and taking care of herself. Um, the ethical considerations with these two models is could be very easy for the clinician to push their beliefs and morals and values onto the client, but it would be really easy to push my goals and my what I want to see happen onto the client instead of the client driving the sessions and coming up with the solutions. It would be really easy for me as the clinician to come up to the solutions for them instead. Um, what I felt good about it, we had a really good conversation, but I wasn't very comfortable with um, the narrative of the story. I wasn't very comfortable with the techniques. I know the techniques, but trying to put two together was very uncomfortable. I'm more comfortable with just the one model, talking about the model. It was a little more hard, a lot more harder putting the two together. Um, what I would change is probably some of maybe the questioning about her feelings and her emotions regarding her husband's death and her life revolving around the children and the loss of her identity. I would probably focus more on that. Um, but other than that, I think it went really, really good. That's it. Thank you.